Today, we're going to talk with this esteemed group of folks. We have representatives from the local level doing those peer-to-peer youth development services. We have a representative here from the state of California who is completely changing the system and the professions and doing the workforce development at that level. And we have a dean of the College of Education and Allied Studies at Cal State East Bay, who is training the next workforce in the graduate programs, both for education and for the behavioral health side, so kind of in this integrated spot. So we're going to be hearing from each one of them, and they'll introduce themselves and talk more about their work. But they're each going to be responding to this report that we put together. So for those of you who haven't heard my spiel already, this was the paper that we were commissioned by the initiative to do, which basically was us, along with a lot of partners and a lot of community-based organizations and a lot of people doing the work at the ground level, that convened a series of listening sessions across the state of California over the course of about a year, listening to more than 600 young people, their families, the communities that they live in, asking them a simple question. Any therapists in the crowd? Put your hand up if you're any therapists in the crowd. Okay, you're gonna totally see that I ripped this off from therapy. The question that we asked them was, if they could imagine that a miracle had occurred. Sup, miracle question, I see you. If they could imagine that a miracle had occurred, and they woke up one morning and suddenly there was this integrated system that met them where they were at, that served all of their needs, that they felt supported. What did it look like? To walk us through a day of what that would look like. And these are the things that they told us. So if you haven't read it already, I encourage you to check it out, because it's not my words, it's their words, and that's what matters. There's a flyer at the front desk if you haven't gotten one already that has links to all the report and a bunch of tools that we put together. So do check that out, because their words matter. So we're going to pick one of the things. So there's 12 calls to action, and they come in 3 different buckets. One is a group of things that are about shifting our thinking. One is about reimagining the services, and then one group is about transforming the systems. And it was really important the way we clustered this, because what we were trying to put forth is that we are all actors in the system. We talk about the system, we're transforming the system. Who's the system? We're the system. We are all individual actors in that system. And so what we really wanted to do was everybody to be able to locate themselves somewhere in there and find something that they can do. Because when you have a tangled mess, you just have to start pulling on a thread somewhere, whatever you have access to, all of us pulling on it together. And so we wanted you to be able to find yourself somewhere in those calls to action and just start making change at whatever level you have access to, because it's going to take all of us. So we're going to pick one that relates to the workforce development, because surprisingly, when we were talking to young people, the workforce came up a lot. Like, we had young people saying, you know, I'm worried about my school counselor. We actually had young people say that they wouldn't go talk to their school counselor because they were worried that by sharing their problems and their stress, that it was going to break her. Because, as one young person said, she has a caseload of 500 students. I don't think that she's okay. So I'm going to take care of her. We saw lots of calls to action about young people saying that they wanted somebody who looked like them, who understood their experience. And they were very clear that it wasn't some kind of tokenizing looked like them, like they shared the same physical characteristics. They wanted somebody who came from their neighborhoods. They wanted somebody who was young. They wanted somebody who had experienced some of the same types of life challenges that they had had. They wanted somebody that they didn't have to have the burden of explaining their life experience and educating that person in front of them before they could even start talking about the problems, because otherwise they weren't going to be able to get it. So we're going to talk about 3 of their calls to action today, and we're going to ask each one of our panelists to respond to how their work is speaking to that call. Now at the end, we have time for questions. And so I really, really hope that you're like flagging questions as you hear things as we go through, and you get a chance to ask anybody on our panel anything that's on your mind. So without further ado, we're going to talk about our first call to action, which is rethink treatment. So young people, you'll see the quotes up on the screen there. These are actual quotes from the young people around this theme. They want us to think about what it looks like and who provides it. And to speak to that, we have our first panelist.
Awesome. All right, Elisa, can you go to the next slide? Awesome. All right, good morning, everybody. My name is Emiliano Rosas. I'm the coordinator of community engagement at Pro Youth and Families. And one thing my bio, got left out, Lisa, so I will not penalize you for that. But I am a proud West Sacramentan. So where are my Yolo County folks at? There we go. So that is one thing my bio left out. So I always like to say I'm a proud West Sacramentan, and I'm a product of West Sac Public Schools. So my WSD peeps, there we go. So next slide.
Now you're just pandering. You're pandering.
So today I'm going to be talking a little bit about Pro Youth and Families, who we are, and our peer-to-peer work that we've been doing out in the community. So Pro Youth and Families was founded in 1981, originally as People Reaching Out, but then in 2017 we rebranded as Pro Youth and Families, and really our three key areas of work are youth voice, wellness, and collective impact. Next slide, please. So as we all know, peer-to-peer programs really increase equity and diversity by supporting youth from different backgrounds on path to mental health careers, diversifying the pool of trusted campus messengers who can reduce cultural stigmas, increasing the sense of belonging on campus, which is huge, and also increasing the knowledge of mental health resources. Next slide, please. So in 2020, we all know, horrible year, COVID, horrible thing. But really, Pro developed a non-clinical youth-friendly response to youth mental health and wellness needs. And before it was even named Mind16, it was named Mental Wellness Champions. But we all know the trademarking process is horrible and long, but we came up with Mind16. And we happen to live in the 916 area code, so I'm just gonna drop that bomb for you guys right there. But really, Mind16 is comprised of 10 lessons that are, really discuss defining mental health terms, dimensions of wellness, stigma reduction, stress in the brain, resiliency and self-care. We all know we need self-care, y'all. That improves our mental health. Trusted adults, impacts of social media, and other resources. Next slide, please. So, in 2021, we developed a super strong partnership with Sacramento City Unified. So between 2021 and 2023, we served, up to 7 schools and delivered this curriculum to middle school and high school students. But really, this work wouldn't have been possible without our community-based partners. And really, those are those trusted partners that are in the community on the daily, who have, that sense of what is going on in that community. And that really wouldn't have been put on, really, if it wasn't for the Youth and Family Collective. And that is Pro's community-based initiative that is all about bringing together community-based organizations to work on collaborative projects that really support young people. So huge shout out to our community partners. So that really diversified the trusted messengers on that campus by, contracting out and really partnering with those CBOs in those communities. But it really increased Pro's capacity to offer the program. So when we think about, rethink treatment, we did, we thought about what it looks like, who's really delivering that curriculum. They want to see, young people want to see people that look like them, that have that real life experience like them. So I think that's huge. And our young people really, really love that. So next slide, please. Awesome. So I'm really going to talk about the impacts of Mind16. So like I said, this cohort went from 2021 to 2023, when we're really hoping to start another cohort really soon with Sacramento City Unified. And we really hope to launch another cohort with other school districts around the state or within our region. So This is data from our 2021 pilot cohort. So 87% of young people learned new things about mental health and mental wellness. 70% of youth participants felt more confident to talk to peers about mental health. 67% of youth participants felt more confident to talk to family about mental health, and 88% of youth participants were more interested in mental health careers. I really wish I was able to pull the data from 2023, but our evaluations team is still combing through that, but those numbers really went up. I wish I had those solid numbers to give you guys. But really, our Mind16 curriculum has been a huge success amongst our young people, amongst our community-based partners, and really, I mean, we're looking for more partners, so that would be huge. So Reagan, our Chief Training Officer, if you could raise your hand, wave your hand, Reagan. There we go. So if you have any questions about Mind16 and how to bring Mind16 into your community, go find Reagan, come find me after this presentation. We so look forward to partnering with you guys and just continuing to break those barriers for our young people because they are the future. And one side note, my boss, my name is Emiliano, but my boss likes to call me a geriatric youth because I'm also actually a retired 70-year-old, my soul, who should be on the beach, drinking a Mai Tai. But that's in my past life. But really, our young people are, our next generation of leaders. So let's continue to empower them and really just show them all of our love and support. Thank you.
Thank you. All right. So the next point that came up in our findings from the Youth at the Center report was this idea that, and it sounds so obvious, like when you read it out loud, I'm always embarrassed, but like, it's true, it still needs help. Help must be available before a crisis. And while that sounds like a really simple, kind of an idea, just go try and get it. It's a challenge. It's still something that we need to address. So here to talk about how the state of California and HCAI is doing their part to help address this issue is our next speaker.
Good morning, everybody. Oh, sorry about that. It's going to be a tough one to follow with Emiliano. My energy level will be definitely lower. But I just thank you all for being here. I'm really excited to be here and talk about what HCAI. So you're going to hear a lot of acronyms. I'm going to try my best to define them all as I go through them. So my name is Hovik Khosrovian. I'm with the Department of Healthcare Access and Information in the Health Workforce Development. I'm the Senior Policy Advisor. So HCAI for a long time was known as a small department that did a little bit of workforce, a little bit of facility, hospital permitting, and a lot of data. So we've grown significantly in the past few years, especially on the workforce side, going from, I could practically say I've been at HCAI for about 15 years, going from a budget and workforce of less than 100 million, it was like tens of millions. Now we're talking about 700 million a year in workforce budget, and a strong investment in behavioral health, which I'll get into as well. But next slide, please. One of the things I always want to do to let everyone know all that we're doing, not just on behavioral health, but all health workforce, is kind of give a quick synopsis of what our department does in health workforce. So we have three main tenant goals within our workforce office. Is to increase the workforce to support medically underserved areas. So these are areas that don't have enough providers of all types. To ensure that the workforce in California is representative of the communities they serve, so it's racially and linguistically diverse. That's kind of an underlying focus of all our programs, is to ensure that we're developing a diverse workforce that represents their communities. And lastly is to serving the Medi-Cal members, ensuring there's enough providers to serve those in need. So we do that through three main areas. One is through education and training capacity, expansion and development in multiple fields like primary care, behavioral health, nursing, and allied health. And second is through giving funding for individuals to really pursue health careers, whether that's through scholarships, loan payments, or developing pathways and pipelines, so we get the workforce that we need in the areas that need them the most. So the quick kind of summary of all the programs, and I could probably spend like multiple hours here talking about all we do and all our programs, and that's not even just behavioral health, that's just everything. But we do focus on expanding primary care with the physicians, psychiatry, significant efforts now in behavioral health expansion, all the way to certified nursing assistants and home health aid workforce expansion. One of our bigger focuses now is on data and understanding through the multiple entities, through the licensing boards, certifying boards, our program data, as well as education data, where the barriers and gaps are and why aren't we getting workforce where we need them, so that we can address them through our programs, develop policies, and hopefully support the legislation that's going to fix those issues. So next slide. So now we get into the I'm sure you've all already heard the Child and Youth Behavioral Health Initiative that the state implemented in 2021. So one of the bigger focuses for HCAI was the wellness coach, certified wellness coach profession, and I'll get into that in a little bit. But there's also additional streams within that Children and Youth Behavioral Health Initiative. So it's a multi-billion-dollar, over $4 billion of investment to multiple departments within the state to really focus on reforming how children and youth receive behavioral health and their families, and to support them where the support's needed the most, and to ensure there's enough providers. So where HCAI comes in is to ensure that the providers are there to support them, and like we speak about, at what point do you intervene to support individuals before the crisis is there. So we're there to help kind of build that workforce. So we received $765 million to really strengthen and expand in the behavioral health workforce. That includes a certified wellness coach, but that includes multiple other work streams, things about 9 to 11 different work streams that I have a quick brief slide on the next one about. So we start with psychiatry and social work education expansion. So we have multiple programs that now increase the residency slots for psychiatry and child psychiatry and addiction psychiatry. So we support with funding programs, graduate medical education programs, and fellowships to really expand that workforce, because we know there's so few child psychiatrists. If we could just add 5 more, we pretty much almost doubled it in most communities. So there's a big focus in there. We were recently awarded in 2022 over $30 million in funding to 8 psychiatry programs and 7 psychiatric mental health nurse practitioner programs. So it was a significant increase, particularly on the nurse practitioner side, because it's a much quicker field to kind of train and get to the community. We've also done a behavioral health workforce pipeline program, expanding the workforce, the pipeline, so supporting, mentoring, tutoring youth at high school and community college level to expose them to behavioral health careers, to provide them with fellowships, with internships, with post-undergraduate fellowships and post-bac fellowships. So really create that pipeline of diverse individuals that can now go into the behavioral health workforce. And then how do we as you kind of got to see, we have this kind of pathway and we call it a lattice, a career lattice, to support these individuals. So we start the pipeline. We next go to scholarships and loan payment. So if we have individuals that are interested in behavioral health, we support them through scholarships, saying like, that's great. You went through the pipeline program, a pathway. We want to support you so you can get your education and become a provider, whether it's a certified provider, you want to go to a 4-year school, become a licensed provider, or go to graduate school or a PhD or MD. We want to be there to support you. And then after they leave the programs, if they have educational debt, we want to support them with loan payment as well. So we have multiple programs going on that. We just recently closed our behavioral health scholarship program. We had a large program that we recently granted. It was community-based organization grant to support CBOs and their workforce through offering their workforce scholarships, loan payments, stipends, signing bonuses, recruitment bonuses, and efforts to really increase their workforce through other measures that they deem necessary. That was a significant program that awarded over $115 million to community-based organizations. So we're really looking forward to seeing the results there. We also have a focus on the justice and system-involved youth. So we developed some pipeline programs for them as well, particularly to support them through wraparound support services, mentoring, tutoring, to have them enter these behavioral health pipelines, because we really believe when you have someone with lived experience that's gone through the system and experienced what they have, they're going to be the best providers to really support the youth that are facing similar issues. So it's really focused on what we do is to ensure that as we build a workforce, we're supporting individuals that have had these experiences, have had lived experiences through their own lives or their families, so that they can give back to the community, they can give back to the children and youth that they know they need it the most. And lastly, one of the other things we've really focused on is substance use disorder and expanding the workforce there. So we did an Earn and Learn program to allow individuals to, as they go through the substance use counselor certification, to receive funds to basically support them if they want to go through and become certified, if they're either registered and they have to meet the requirements for the hours, or if they want to go into the field themselves. So That's kind of our broad behavioral health work stream that's affiliated with the Children and Youth Behavioral Health Initiative. But now I know everyone's really probably interested in learning about the wellness coach, so I'm going to go into that. So the wellness coach really is to increase the overall capacity of support for children and youth at all levels of where they are. So we talk about, where the wellness coaches are going to be. So this is a brand new profession for the state, for HCAI and what we're doing. Some of you might see kind of the description and be like, well, there's others do similar things, and that's true. They do. What we want to do here is we wanted to create a profession that's recognized statewide, has a process for the education and certification, and also not, we didn't want to set aside professions that are already doing it. We wanted to kind of lift them up and say, we now have a statewide process. You might have a similar role, but here's a way where you can now become certified. Potentially, then you can bill private insurance and Medi-Cal for this service, and we also are going to support it in the schools and anywhere where children and youth are interacting. So, community health centers, community centers itself, anywhere in their community outside of the school. So it's a real big push to ensure that there's that we're meeting the gap between entry-level behavioral health specialists to straight to license. We noticed there was a gap there. There were professions that were trying to fill it, but there was different titles, there was different roles. We really wanted to streamline it, but ensure that those people that were in those roles were not left out, and they can participate in this through kind of an experience pathway. So one of the focuses there is to build this profession, ensure that we're meeting it through a diverse workforce. So one of the things we do is as we start kind of promoting the profession and talking about what it can do, we've started this large marketing campaign. It just recently launched. So I don't know if anyone's already heard some of our radio ads. We're going to do some podcasts. It's going to be a large media blitz to really inform the state about the wellness coach. So everyone's going to start seeing a lot more. We just started. We're going to have a web page up. So there's a lot to. Again, I could probably go on this for hours, but there's a lot to talk about. But really, the focus of the certified wellness coach is to support the youth to be, and I think we've kind of heard. The children and youth want help, but they want individuals that understand what they're going through, that experienced it, that are like them, and that's what the wellness coach model is really based on. So go to the next slide. So these are the competencies. So there's a long list of them. So one of the things we did as we kind of developed this wellness coach, so we started. It's been 2 years now, the process, where we did a lot of background research to understand what the roles are that exist. There's a few other states that have similar roles. Some of them are within the Native American tribal lands. They're not called wellness coaches, but they have very similar roles. So we learned a lot from them. We learned a lot. Alaska has a program for this. So we learned through a few states that kind of implement similar programs and professions. What we can do as we developed that model, we had multiple stakeholder listening sessions. So we spoke with with many of the county office of education, local education agencies, other state agencies that are involved in education, and then the community as well. And as we moved through and developed the model, then we went to focus groups. We interviewed families and children and youth to really say, does this work? Does this work for you? What do we need to change? What do you need? So then we can work on the model, come back to them and be like, hey, we made revisions based on your feedback. Well, then we went out back to the county office of education and all the education agencies and said, here's where we're going forward with. What do you think? Give us your feedback. So it was 2 years of just a lot of communication with stakeholders, really understanding what they need. So we're not just, a lot of times you don't want to be that state agency that just says, here's a profession, go ahead, use it. And everyone's like, well, this doesn't work for us. What did you do? And so we didn't want to be that. We wanted to ensure that we're giving a profession that people can use and people need. And that was kind of our process, and that's how we came up with these competencies. Now, the profession itself, what we've done is left it flexible enough that schools, local agencies, community-based organizations that hire them have flexibility to say, all right, well, we don't need all these services from them. We need these particular things. So we've tried to leave it flexible enough so that this workforce can support you however you need. So next slide there. So one of the things we did is, again, we're looking to fill that kind of gap between an entry-level behavioral health professional like a peer support specialist to the next level of licensed professionals. So as we kind of go through that, what we're developing is the wellness coach model itself is individuals with an AA degree or similar workforce experience. And as the community colleges and the CSUs start developing these wellness coach programs that we're working with them on, there'll be an actual degree similar to, if you're doing this AA in social work, an AA in human services or psychology, then there's a pathway for you to become a wellness coach through the community colleges and the CSUs. But prior to that, we're going to launch the certification program for individuals that already have similar degrees or similar life experiences and the workforce experience to go through and become certified wellness coaches. So we have that workforce prior to the schools or developing the education for it. So kind of a timeline here that we talk about. So right now our marketing efforts are launched. In early 2024, we're going to have the certification for individuals that already have AA and BA degrees in social work, human services, psychology, or work experience. And we're also developing employer grants. So this is one of the things. So right now, the certified wellness coach there's a state plan amendment being developed to ensure that they are in the fee schedule to be paid through Medi-Cal and then through private insurance as well. So as that's kind of working through the system with our sibling departments, we're implementing employer grants to support employers, the local school agencies, CBOs that want to hire these individuals. So they can apply for grants that'll support scholarship for those individuals that want to become trained in them, a loan payment for individuals that potentially might go through an AA degree and then become wellness coach certified, and then individuals on their own staff that they want to promote to become wellness coaches, as well as hiring wellness coaches once we have them certified early this year, and supporting them through their salaries. So there's an employer grant cycle coming out early next year. And then in middle of 2024, we'll offer the scholarships broadly for individuals that want to go through the community college and CSU system for this wellness coach certificate. And then the training will open up toward the middle end of the year when the school year starts in September, with ultimately sustainability in 2025 when we're estimating that this professional will be Medi-Cal eligible for billing. So I know it's a lot of information. So the focus here again is to really support the students where they are, with a workforce that's there to intervene and help them before it becomes a crisis. One of the key focuses of this workforce is to help the teachers and the counselors in the schools, because we know they're stretched thin. So we're developing a workforce that can step in and support them and say, like, let me help you. I got this. I will help them find the services they need. I will help them find the support they need. And that's where we're going. I'm happy to answer questions later. I know I'm running over time, so I wanted to give it to Dr. Williams here next.
Thank you so much. All right, and our final panelist is Dr. Williamson from Cal State East Bay. I'll let him introduce himself, and he'll be speaking to the final one of the points that we're highlighting from the report today, and that is that the young people across the state really called out that we needed to build a representative workforce. And so Dr. Williams will be speaking about his work in that vein.
There you go. All right, I've never been silenced before until that moment. Well, I thought I knew what I was going to talk about because I have slides for it, and then I listened to these two gentlemen and Lisa, and wanted to start with saying that as the Dean of the College of Education and Allied Studies, it's been clear to me that my goal and my mission with that college is to truly transform the East Bay community, Contra Costa County, and Alameda County in terms of mental health services in the K through 12 system. And when I say, that does I applaud everyone that I work with for sure. And we definitely we're moving in the right direction, and that's part of what I'm going to talk about. Before I begin, I want to just tell you a little bit about this. I used to be a licensed psychologist for 15 years, and many years ago, decades ago actually, I used to work with this young black kid and his family, and I was using the motto called Brief Strategic Family Therapy because I was trained by Jose Shapasnik and Howard Little, and I would go out to their homes and provide home-based counseling. So it was a multi-systemic approach. And while I was working with this particular kid, let's call him Johnny. That's not his real name. Actually, I don't remember his name, to be honest with you. While I was working with him, the mom worked a lot, and she was struggling with trying to help provide him with the kind of support that he needed in the school, in the juvenile justice system, and with respect to overuse of marijuana. So he was kind of that I don't care anymore mentality. The school, when I met with the school folks said that they didn't know that she was a working mom. They just said, well, she's a welfare mom, so she probably just is not engaged. So there was clearly racism involved in this particular case. And then the juvenile justice system was what it is in that particular area. And what I mean by that, it's about individual accountability, somewhat about reform depending on how serious the offense is. But when I worked with that family, it was about an integrated approach. I coached the mom on how to talk to the school officials as a counselor. I helped her figure out a way to talk to the vice principal about needing him to trust her. And when I met with the school, the vice principal, I talked to him about needing to learn how to trust the mom and her very competent parenting abilities. And once we got them in the room together, we made real significant movement. And then the juvenile justice system was where I coached the mom on how to talk to her lawyer and how to talk to the court system. And I did not stand there for her. I gave her the coaching. I stood there near her so she could feel reassured, but she did the talking. So this kind of multi-systemic integrated care that I know your social workers in the room, where are you social workers? Yeah, you all like that, don't you? It's second nature to you. But it's not second nature to others. But having that multi-systemic integrated understanding as a clinician is really critical from my perspective. Now, I understand that the goals and the themes of Breaking Barriers is about one child, one family, one system, and access to behavioral health and cultural competence and cultural humility. And one of the key sentences that I read in the executive summary was identify how current systems need to function differently to move toward the vision of a transformed behavioral health ecosystem, which is perfectly aligned with what we're trying to do over in the East Bay. So some concerns that I have in trying to achieve these goals is the adultification of our BIPOC children, because they are children first. And if too often people see them as adults. And also the infantilization of BIPOC parents. That's the other flip side. Too often parents who may be monolingual or working too much working a lot like that one mother I was describing earlier, they're treated like children and they're infantilized. I will not get an applause for this next one, but a concern that I have is about outsourcing off-campus services for tier 3 services in the multi-tiered services model. But the cost of care is a barrier that was recently addressed in the previous speaker, but also the behavioral health qualifications of the traditional school counselors. School counselors, when I worked at San Francisco State, where I was there for 22 years, it was a very traditional model, and I actually had conflict with someone who was very traditional because I wanted them to do more, traditional mental health, and they were about wellness, period, tier 1, tier 2. And I was about, hey, I need to train these folks to understand tier 3. Cal State East Bay is where there's a greater focus on mental health, more of the model that I'm more comfortable with. So we have 5 departments in the marriage and family therapy program, the school counseling program, the school psychology program are the programs that focus on mental health. And one aspect of our vision for the college is about producing graduates who are powerful actors in their communities, which is congruent with my vision that I shared with you at the very beginning, being transformative. Now, I will say that we've been talking about new visions around the campus, and the word radical doesn't seem to resonate with people, but I keep on talking about a radical transformation is really the word I'm going for. And as you all know, there's $184 million that's been allocated over 5 years for the CTC, the California Commission on Teacher Credentialing, to build capacity in school districts for robust school behavioral health services, particularly focused on school counseling. Have y'all heard that? Raise your hand if you heard about that. Good. That's some of you. Hopefully all of you here know, now all of you know about it. So these are called school counseling residency programs that will be funded to local school districts or LEAs. A $20,000 stipend will go to the school counseling students. So this is regular candidates that we accept. And supervisors also receive a stipend. Typically, your supervisors are already working for an organization, and that's built into their schedule. But this is an additional $2,500 a semester or per year, depending on how it's structured. These are still high-need areas. And the first stage of these grants is to build capacity for a year or two and then to implement after that. And it requires a partnership with the local IHE, Institution of Higher Education. So we have a model that we are building right now in San Leandro Unified School District. So they got the award, and I helped them become a partner with them. And this, for the next 2 years, we will be building capacity in San Leandro in order to provide high quality, culturally competent mental health services through our school counseling students in high need schools. And that's a really good that was one of those sparks that happened. And then I was approached by and I'm in early talks with the Alameda County Office of Education. Just a brief conversation, and we're going to follow forward with that to provide services to multiple districts. So that requires somebody else, because there's also a capacity of leadership. I don't know who can help with this. I already got somebody, but hit me up afterwards. I got folks over here running to help, and I didn't even think about social work, but thank you for raising your hand. So we're going to be working with them on 1 minute. Gotcha. Or just one sentence. I'm just joking. But we're in very early talks with them in order to establish this model as well. Again, 2 years of capacity building and then subsequent years of funding. So this is what I'm looking at here is high quality, culturally affirming, evidence-based behavioral health training for master's level school counselors. This is non-traditional, because the traditional model is more about wellness and prevention. It's about being one system in a multi-tiered system of supports. Schools will create a tier 2 programming that will prevent, per what you just said a moment ago, escalation to a tier 3 crisis or more serious mental health issues. Schools will have Cal State East Bay qualified school counselor trainees on their campuses, per one of my concerns I expressed earlier. And outsourcing will continue, but we have a community counseling clinic on campus that provides services only to the community, not to the campus. And we will be one of those free behavioral services. So there's no Medi-Cal or anything else required. You just show up. But of course, we need money. So I fund that, and so does Hayward Promise Neighborhood. But I'm working to find about $6 million so that the clinic will have what I describe as financial impregnability, so that it won't matter what the whims of the dean or anyone else is, they'll be able to continue. So that's what we're trying to do over there, build that model with schools, with an IHE, us, and also with other providers as well. And we want to do it in a culturally competent way, in a way, like I said before, that's going to fundamentally transform how we provide mental health services. We're at 10:46. I think I'm about 30 seconds over. Thanks.
Thank you, Dr. Williams. All right, now it's your turn. We're taking any kind of questions. Do we have a mic? Wait, we have a mic coming back to you. And it can be addressed to the whole panel, an individual, whatever works for you.
I just want to thank all the speakers for, just all the information you presented. It was super enlightening. My question actually is just kind of going back to the very beginning of the talk. And I really appreciate that it was named that kind of the behavioral health system the history is pretty explicitly rooted in white supremacy, patriarchy, colonialism, capitalism. And this is kind of like a big two-part question, but I guess one, what is kind of our role as social workers kind of committed to creating a better future for our youth in kind of explicitly naming and working to disrupt those systems of violence? And then two, what are kind of appropriate and effective ways to engage in that work in the workplace? And I think I just kind of want to give a little bit more context to my question too. I'm coming from this as somebody, I just started here at YCOE, so I'm kind of more referencing some of my previous social work experiences, but I was working in social work in Alaska, and we, a couple of the talks have kind of triggered a lot within me, but within the past 6 months, we had a 21-year-old youth, Alaska Native youth, who was picked up by law enforcement for a nonviolent misdemeanor. She was having a mental health crisis, and within a couple of days of being held in jail, she died. So I think it's really easy for a lot of folks to kind of roll their eyes and dismiss kind of these, like big words, capitalism, white supremacy, and kind of dismiss the importance of having conversations about it. But this is very real things, and it's having very real impacts on people. And I know we all know that, a lot of us firsthand, and a lot of us through our youth. So, kind of a big question, but I just really appreciate you kind of naming that in the beginning of this speech in your talk. And I really am interested in how we can kind of bring that work into social work. And I also want to figure out ways to do that in effective and appropriate ways, knowing that everyone is kind of on a different place insofar as what their understanding of those systems are. Thank you.
Who wants to take it?
Well, I never shy away from an opportunity to talk sometimes. That's why I'm a dean. My quick response, I think he was kind of referring to you, wasn't he? But I will speak to that. We need allies and we need accomplices. We need folks to build themselves into a system, and at some point, in the Trojan horse sense, reveal that now that I'm in a leadership position, I can make the changes that need to happen. Because if you know systems are homeostatic mechanisms, and they are about maintaining themselves. And they will spit you out if they discover something that's what they consider to be a disease. So if you're going to push back, figure out if you're going to be a radical pushbacker, which means that you're just going to make a lot of noise, or if you're going to be sort of a reformist, or if you're going to walk into the system quietly, get into a leadership position, and then make the change. And I'm more in that area where I'm acceptable, but I'm actually radical. But I am acceptable.
And I know I'm not a panelist, but I want to chime in a little bit because you gave me a little shout out for my little patriarchy speech at the beginning, which I was nervous about saying. I would say whatever privilege you have, you need to use that. So don't just think that, so as a woman, right, you would expect that I would speak out against patriarchy, right? And so a lot of men will take a step back when something starts getting hot and expecting me to go and address some of the patriarchal stuff that's been happening with the men and speak to that because they're afraid of, speaking in a place where it isn't their fight or it isn't their cause, it isn't their issue. But we need people who have privilege, who are not experiencing that kind of oppression, to manage their people. So if you're a man, you need to go speak up to the men about the patriarchal stuff that's happening. Don't just depend on the women to come and speak about it. And the same thing, I hold privilege as a white person. So I'm not going to sit back and wait and let the people of color speak to the racism that's happening in the room. I'm going to use my privilege to manage my white people and talk to them about the things that we hold responsibility for. So I would say whatever privilege you have, and we all got some kind of privilege, whether it's, able bodies, whether it's, being a man, whether it's being white, whatever it is, having an education, a higher education, not having lived in poverty, those are all privileges. So whatever privilege you have, manage your people, speak to the people, and don't just leave it to the folks that are experiencing the oppression and marginalization to fight the battle alone.
Hello. again. My question is, I loved your presentation, FYI, it was great. But my question is, we have the resources and we have the funds. How are we engaging the education field, and how do we motivate people to be a part of this? And what are your next steps? Because I know for a fact a lot of people do not want to be a part of education. How do we motivate those? How do we get educational opportunity for those who are homeless, those who are out of probation? How do we get people a part of this? And what are your next steps?
You want to take that? You think you can?
Call them out, Saran.
So I could say on the state side and workforce, a lot of our focus to build that is in the pipeline and pathways programs, because we've been, for many years, we've given funding to residency programs. So individuals basically that were already at graduate level or already in the 4-year degree. And when you keep doing that, it's almost like you're just kind of repeating the process, being like, we'll get more providers, because we're paying for them to get their education, and they're obligated to work there afterwards. But you're not really filling in the back end. You're not getting individuals that are diverse, that have a lived experience, that have come from different backgrounds into the schools, into those professions. So we have multiple names for different programs, but it's called the Health Professions Career Opportunity Program. And within that, we have multiple programs. The main one is the Health Professions Pathways Program. So again, with the acronyms, we call it HPPP. It's not very fancy, but what we have in that part now is we have ongoing funds to support these pathway programs. So every year now, previously we'd have like one-time funds, like, hey, let's try to do something, but again, it's one time, maybe we'll hope for the best. Now we have the opportunity with the ongoing funds, with the support with the Children and Youth Behavioral Health Initiative, to really make a change. And a lot of times I've been with doing this for 15 years, and I've just, over time, I've just been like, how can we just keep giving money to providers that are already trained, and that's not going to change how they work, how they think, how they believe. They're just going to get the funds. They're going to go work in the underserved community, which is great because we want to expand that, but we're not making a change to how people think. So we're not changing that implicit bias that providers have. We're not changing the cultural competency of the individuals. We're just kind of feeding a system that already exists. So with that pathway program that we now have, we're really focused on saying, hey, if you want to develop a pathway program, getting kids from high school, even earlier than high school, and to community college interested in these professions in behavioral health and primary care, allied health, nursing, we need you to go out and reach out to communities that are marginalized. We need you to reach out to the LGBTQ students, get them interested in these professions. And we need you to go out and find individuals that speak multiple languages, that grew up in communities that just did not fit what everyone else sees as a typical community. So we need those individuals, and that's what our pathway programs are doing. And it's really kind of this new change that I'm really excited about the state is doing, because we're done with let's just keep doing the same thing. And this opportunity here with the CYBHI and all the initiatives we have now is, let's change the system, because we can't keep doing what we're doing. We're just not going to get the results. We got to fix the problem at the beginning.
Last comment, yeah, and then we got to wrap it up.
Give it a hand. I want to just jump in real quick. So the state of California, the governor's office provided several $1 million for various regions within the state of California to integrate, create collaboratives between K through 12 and CSUs and UCs. So in the Bay Area, we received $18.13 million about 2 or 3 weeks ago. In order to do that, $4 million of that's coming to Cal State East Bay, to my college in particular. And it is about getting, working with kids early in their K through 12 career to begin to look at preparing themselves for careers down the road, particularly in education and computer science in this case. But because I'm a mental health professional, of course, I slipped that in there. And I also happen to be the co-PI, so there's a way to make that happen. So we are actually funded very well, but not, it's for 3 different regions. So San Jose has some money, San Francisco State has some money, and we have some money. But we're going to make this work, and I would encourage anyone who's in the East Bay, San Jose, or San Francisco, you can hit me up, and I can give you more information about that and learn more about that, because we're looking to sustain this well beyond the next 5 semesters.
Great. And with that, we are over time, so we're going to wrap it up. I want to thank all of our panelists today for a really insightful panel. There are some resources for practice about some of the things that you heard up on the screen as well to check out. Thank you very much.